Our next speaker is going to be Dr. Anne-Nora Earhart, and she is going to talk about the effects of climate change on the human health perspective.
Thank you. Good afternoon, everyone. My first impression is that the speakers before me are having a lot more fun at work than I am, and maybe if I get one of those seabird hats, that would lighten things up. But I'm really pleased to be here today. I am a family medicine physician and medical director at the local clinic here, the Luluik Family Health Services. It's a community health center over on the Unalaska side. I have been there since about 2007, except for 2 years when I was back in Maine. And it's my pleasure to serve this community and the region. My interest in climate change is very personal. The medical training is just now starting to introduce the link between environmental health and human health, and it's a very important topic to me personally. So, my co-presenter is in the air, unfortunately, but she'll be around for the rest of the conference. She's a very interesting physician who works not only in the Valley, but helped start the Anchorage Family Medicine residency. She also is a political official and has been recently appointed to the University of Washington, the WWAMI program, which is the medical school representatives from our region. So if you see her, her name's Barb, give her a little chat. Okay. So we're going to start kind of from a global perspective and then work our way to the region. So the World Health Organization has been involved with and concerned about climate change for decades. These are the areas that they identify as the most important consequences. And number one is food insecurity. We've been talking about this in different ways throughout the conference. 2 extreme weather events. Everyone watches what is happening on the news. From the public health perspective, which is what we're tasked as an organization to look at, we're concerned then about disease outbreaks, loss of shelter, injury, poor water sanitation. Then we talk about water scarcity and contamination leading to GI problems and infectious diseases. Also, number 4, heat waves, heat stroke, the consequence of high pollen count. Also, number 5, which is very important, and we're hearing more and more about this with chikungunya and Zika and different locations of malaria being found in areas where they haven't been before, this broader geographic distribution of the vectors and the infectious disease spread, which is a whole lecture in itself. So this is talking more about regional effects and giving examples. When I worked out in the Northeast, there's a huge epidemic of Lyme disease and also West Nile virus. It's a huge public health concern, and there's a lot of controversy over diagnosis and treatment, as I'm sure you all know. And that is something that is specific to a region, but we're seeing it spread throughout the country. Luckily not in Alaska yet. Alaska, what this group, the American Public Health Association, this is their slide, they identified in Alaska focusing on the loss of permafrost and retreating sea ice, changing the lives of Native people, causing an increase, again, talking about pest outbreaks. So these are just some specific examples of the infectious disease concerns, and I won't go over everything, but for physicians and nurse practitioners and PAs and nurses, the folks that are helping take care of you when you get exposed and infected, it's quite a challenge because we're relying more and more on infectious disease specialists. As a medical student, I spent a month down at the Center for Disease Control and Prevention in Atlanta. And it is impressive, the research that's being done and the field work. We are very fortunate in Alaska to have excellent CDC support on a national and a state level. So this is a picture from China. It very well could be. Some are telling me in Brazil. The air pollution is contributed from wildfires, storms, the loss of the ozone layer, and many people know that significant respiratory illness and disease is occurring in these countries. Something that we hear some talk about, but not as much, is this organic compounds and how that affects the human development, either perinatally or afterwards. And talking about how trade winds and currents redistribute some of these dioxins and PCBs, and how and why those are linked to cognitive defects in children. There's a lot of research that's going on in the neurological world about autism and dyslexia learning disorders, and it's a very interesting area with a lot of implications and still a lot of unknown. The endocrine disruptors are also something that we're looking at as far as being affected by these synthetic organic compounds, thyroid disorders, low fertility, and really we're talking about also, the effect on your immune system. Weather-related morbidity and mortality, trying to identify vulnerable populations, and that could be including the Aleutians because of our remoteness and the isolation. Planning in advance, if you're on a chronic medicine, having a plan for emergencies, et cetera. This is, as many of you know, the Museum of the Aleutians lobby, and one of the groups that has done a very amazing job addressing climate change is the Alaska Native Tribal Health Consortium. I am not working with them directly, but I have worked with people who have, and this is one of the slides that really identifies and puts into perspective in Alaska specifically what the health effects of climate change are. The Alaska Native Tribal Health Consortium has also partnered with the Center for Disease Control and Prevention to form a group called One Health, and they are connecting the environmental health and plant and animal health with human health and looking at that. It's a pretty exciting time, I think, and I keep hearing this in different talks about collaboration between groups. So as you know, we have in our community unique challenges from a public health perspective, just also based on the industry and housing and exposure, people coming in from all over the world to work. And so we always have to keep that in mind. We work closely with our public health nurse, who was Lorna Plentikoff for many, many years, who was recently retired. And as you all probably know, the state of Alaska budget has cut public health funding, and about 30 nurses, public health nurses, had to be furloughed, and hopefully that will change in the future as these emerging infectious diseases and other things become more to the forefront. So what is the healthcare community doing? There's obviously research that's going on. They're looking at infrastructure and capacity building. I belong to an organization called Global Family Medicine Doctors, and Barb and I presented at an international conference in Dubrovnik, Croatia, a year ago, and we sat down with a group of family medicine doctors from all over the world and talked about identifying what are the vulnerabilities in your community. And it was fascinating. We had people from Japan and New Zealand and China and Canada and really coming up with some of these core things, and I'll talk about that a little bit. And then also working with your state and local agencies, and I'll give some examples of what's being done. I'm really excited that one day in the future, we'll be able to have a center of excellence, maybe even here in Unalaska, that would provide training, climate-ready clinician training for, say, community health aides, for citizens, for healthcare providers that specifically integrates knowledge about environment and climate and healthcare. The CDC has created what they're calling a BRACE framework, and this is what the steps include. So, forecasting the climate impacts and assessing vulnerabilities. So there's actually a document that you can go to online and do an assessment of your community that helps identify where you're vulnerable. And then you can target your energy and your resources to that specific area. Projecting the disease burden, assessing public health interventions, developing and implement a climate and health adaptation plan. And then, of course, you always want to evaluate the impact and the quality of what you're doing. I thought it was very interesting that the funding, about a year ago when I checked on this, the climate and health adaptation plans, these were the states and the cities, and Sweden was the only country that had funded health adaptation plans that were specifically related to climate change. So hopefully we'll be seeing more of that. Disaster preparation is also very important. We look at the community as a patient. And then we have collaborations, especially with the city. You all know that the region gets together for the Local Emergency Planning Commission. In fact, the meeting is this Friday, and that is an excellent regional collaboration. We do drills, all sorts of things like that. You know, we're preparing as a community. You also want to prepare as a family and as an individual, and that's a whole nother lecture. These are some of the resources that I've enjoyed accessing. I have specific ones also, like Healthy Planet or 350.org or the Breath Life campaign that can be really a source, a wealth of information. The World Health Organization has a climate training program online specifically for healthcare providers or people that are interested in the health aspect of that, and that is also extremely valuable. This is their climate resilience, talking about health systems and building blocks. So the key factors, again, are the leadership, governance, funding, just like with any of these projects. Looking at your health workforce. So again, looking at training people that understand the impacts of climate change on health, and then building that resilience. The vulnerability assessments, integrating the risk monitoring, emergency preparedness, climate resilient technology, management of environmental determinants of health, and climate informed health programs. So once again, getting back to this slide, just to put it up there as a reminder, it's really integrated into how we live. In so many ways. I mean, we are used to living along the chain where you have volcanoes, you have many natural things that dictate how we live, weather. But really thinking about what does it mean when you have poor water quality, if you have infectious disease in, you know, in the shellfish, and how does that impact you and your family? So you can rest assured that the state and the country and the global organizations are aware of what is going on. I think what we're trying to do is work on the public health level with the providers, the clinicians, and the communities. And so continuing to have those collaborative agreements, work with people on identifying the risks and the vulnerabilities in your community and then working together to become prepared and resilient is really what we're trying to do. So thank you very much to the Aleutian Life Forum. I am just so impressed that this is going on right here in our own backyard, and it's a very valuable experience, and thanks for allowing me to participate today.